Okay, so good morning, everybody. So as promised, I have got a number of workshop tutorials and this one or this set of tutorials are all around diabetes, and I'm so delighted to have with me today Karen Lewis, who I'll let you introduce yourself. That's probably the best thing to do. So.
Okay. Well, hello everybody. My name's Karen Lewis. So I qualified as a registered nurse in 1984. And for the last 5 years of my career, I specialised in diabetes. So I was a diabetes specialist nurse. And then I retired about 3 years ago, which you could do if you joined back in the day. You could go when you were 55. So I retired 3 years ago. And I started working on the diabetes prevention programme. So for a number of years, I've been very interested in health and well-being. And now I work on diabetes prevention.
So in the last session that we had, we talked a little bit about what diabetes is and how to recognise maybe that there are some symptoms that could make you pre-diabetic, and how to, or the importance to become proactive rather than reactive. What I'd like to discuss now, Karen, if it's okay, is you mentioned a couple of times about a well woman or a well man appointment, and that's where maybe it would be picked up. Can you tell us a little bit more about that and about the tests that go on and what people should expect from the testing process?
Yes, so as we said in the last podcast, most people who've got raised blood sugar are unaware. They don't feel any different to how they felt, perhaps a year ago, 2 years ago. It's completely asymptomatic. So at a well woman or well man appointment, which you usually get invited to when you're over 40, they do a number of blood tests. And some people will have what's known as a random blood sugar test. So you may have seen people who've got things like diabetes testing their blood sugar with a meter to find out what their blood sugar level is there and then. With that test, if it's 5.6 to 6.9, if you get that number, that shows your blood sugar is up, but not enough to be diagnosed with diabetes. That would be a result that's pre-diabetes. If it's 7 or above, that can be a diagnosis of diabetes. But the main test, the gold standard test we use in this country to say if somebody's got normal blood sugar, if they're pre-diabetic, or if they've got diabetes, is something called an HbA1c test. So that's H for Harry, B for Bertie, A for Adam, the number 1, and C for cat. HbA1c blood test. And a bit of a clue with that really is in that HB. HB medically stands for hemoglobin. That's part of the red blood cell. And what that test does is it measures how much sugar has stuck onto red blood cells. Okay. They live for 3 months.
Yes.
So from that, your doctor or nurse, when they get the result, they can get an average of what your blood sugar was doing for the last 3 months. It's the only long-term test we've got of what people's blood sugar have been doing. So often people, referred to us will say things like, well, I did have a lot of sugar the day before, or, but actually it's a 3-month average. If you were having just that random finger prick test to see what your blood sugar was there and then, sometimes people will be asked to fast to have that, or it will just be random. So it's just a finger prick blood test. Obviously what you've had the day before or what you've had that morning, could impact on that. But the HbA1c is a 3-month average, and it's the best we've got because, we want a long-term test.
Absolutely, yeah.
Yeah. So the parameters with that, because as humans, it's a normal thing that happens to us for the sugar to stick onto our red blood cells. If you go and have an appointment and you have this checkup at your routine well man, well woman appointment, any number between 20 and 41 is normal. So if you've got a result for that and it's 20 to 41, you're completely non-diabetic, you have normal blood sugar. If it comes in between 42 and 47, you're what's known as pre-diabetic. So you're borderline diabetes. You're not diabetes, but you need to really home in on lifestyle to prevent yourself becoming diabetic. 48 and above is a diagnosis of diabetes, so sort of type 2 diabetes. We mentioned before, didn't we, that you can live with type 2 diabetes for up to 10 years.
Yes.
And so you've got it. Type 1, because people don't produce any insulin at all, has a very rapid onset and people are acutely unwell. So it might be that they've picked up somebody who's developing type 1 diabetes, but usually it's type 2 because 90% of cases in this country are type 2. So it's this blood test. These are the blood tests that are used. People can go on the Diabetes UK website. There is a questionnaire for looking at your risk of diabetes. It's all explained. If you hit a certain number, it highlights the fact that you're likely to be in this pre-diabetic range, and you can refer on to the diabetes prevention program. So there's a number of ways people are looking at, have I got raised blood sugar? Obviously that questionnaire is only a guess, really, but it's saying you're probably somewhere in there because of all these risk factors in your lifestyle. The random blood sugar, or the fasting blood sugar, which is a finger prick test, will say what your blood sugar's doing, but the best test is this 3 months average, the HbA1c, which is where they withdraw blood from your arm and send it away, perhaps with your cholesterol tests, or if kidney tests. It goes to the lab to be processed, and then we've got this range that comes back. So your doctor or nurse knows whether you're on normal blood sugar, pre-diabetic, or have gone on to develop diabetes.
I think it's probably safe to say that all GPs would want their patients to take some sort of responsibility for themselves beforehand, to have a look at their lifestyle, to make some decisions as to whether they are, and to actually respond to those well women and well men opportunities that just out and check up for themselves. And I know that sort of in the last section we're going to be looking a little bit more about what you can actually do and all the different support mechanisms that are out there. But certainly I'll put a link in this to the questionnaire, because I think that would be good for
people can directly refer on to the diabetes prevention program. And I don't want, it's not nice to go along and be told that you've got an abnormal result, but really picking things up early, even if you've got a diagnosis of diabetes, and getting good control of your blood sugar, that's really the thing to do. And a lot of people who've had type 2 diabetes are not known for, say, 10 years plus. The way they present is with a complication of diabetes because they've had changes to their blood vessels due to raised blood sugar. So nobody likes to be told their blood sugar's abnormal. Certainly on the diabetes prevention program, we have a 72% success rate of getting people's blood sugar back to normal. So please, although it sounds very scary, you can impact on your blood sugars by lifestyle. So it's all doable.
Fabulous. I look forward to talking to you in a moment about the anatomy and physiology and what's actually happening in your body.
Okay, speak soon.